I'm a psychiatrist and I work with patients whose primary diagnosis is an eating disorder. I've seen patients as young as 6 and as old as 60. So the consequences for people with eating disorders who can't access appropriate psychotherapy at the necessary frequency is grim. 1 in 10 will die from their illness if they don't recover. And treating weight loss, refeeding people does not actually result in recovery. We have to really get to the deeper issues. They may have depression or anxiety. A lot of them have trauma histories or PTSDs. This is an illness that is a chronic, debilitating illness that eventually kills people. And psychotherapy gives them the potential to make a full recovery and lead a full, meaningful life. The way therapy works is that what you're creating is a safe place and a safe relationship to be able to be seen and heard in a non-judgmental way and to make the unspoken spoken. Because once you speak it, you can look at it and decide what you want to do about it. That reduces their isolation. It helps them feel not alone. It helps them to feel understood. It's one of the few evidence-based treatments that we know works. With many of my patients, nobody else will see them. A family doctor will not take them because they're too complicated. Psychologists or social workers don't have the medical component. And there have been times where a patient has talked about a confusing physical symptom that just occurred. I could tell they were having a life-threatening problem. Someone without the medical training would have missed that. So the reason patients with eating disorders do not access private psychotherapy services is because it's unaffordable. It's absolutely unaffordable. To have intensive therapy over months or years is certainly beyond the ability of a 20-year-old student to pay for, or someone who's so debilitated they can't work and are in and out of hospital. I like to say that my patients could all teach CBT because they've had it so often, and it hasn't worked. Because if it had been enough, they wouldn't be coming to see me. I'm going to quote one of my patients who said that psychotherapy tethers her to a meaningful life, and that without it, she would have continued on her track of self-annihilation. She was just going to make herself disappear into the grave, and is now doing much better, and that's the most rewarding part of this job. They get better, and they go on to lead interesting lives. They make the world better, and we need to help them get better because we need them, and they deserve the treatment that's going to help them.